But moving on to this, the Eastern Cape Premier Oscar Mabuyane has announced members of the Executive Council with no major changes from the previous administration. Mabuyane's committed to do better and thanked the people of the province for supporting the ANC during the 29 May general elections. The party garnered more than 62% of the votes.
We thank the people of our province for their unambiguous mandate they've given the ANC-led government for the 7th administration. And our people have been quite unequivocal in saying that the ANC must lead and champion their complete liberation. We commit that from this day onwards, we will do more, better and faster to ensure that the ANC-led government delivers on its 2024 manifesto commitments. So we're one of the few provinces that the ANC can still say the manifesto that ANC adopted, it will be implemented. Because that's the manifesto that must take this country to another level. So we're not going to be negotiating with anyone. Njengoba nisibona apha nje besithe kwi-6th term asuzuhamba sidlala sithunyiwe. We continue with that. We must be found where it matters most to ensure that ubomi babantu bakuthi buyaguqulwa.
Our reporter Sipha Kema has been keeping an eye on this story, and she now joins us to tell us more. Sipha, a very good afternoon to you. It seems the more things change, the more they stay the same. No major changes there.
Absolutely, and as the Premier of the Eastern Cape, Oscar Mabuyane, said, if it's not broken, why fix it? Now, this was expected, of course, Masa, that he would retain majority, entire Executive Council, apart from the 2 vacant positions from Nomakosazana Meth and Dombovuyo Nkopane, who have moved to the National Assembly. All eyes were on the 2 new MECs that were going to be announced today. And I'm joined by one of those MECs who actually has such a daunting task ahead of her, Masa, leading a department that has become notoriously known over the years for poor services or major issues, scandals coming out of that. I think let's start off by, when you were given this department, how surprised were you? Were you intimidated?
I was very surprised. I didn't expect it, but I am here. We have a responsibility of giving our people services. So, of course, I was really shocked. I didn't expect it, but I am delighted and honored that the Premier decided to give me this department. It's a department with huge challenges. The issue of budgets, the issue of poor infrastructure, poor services that is rendered in our institutions, but we have a responsibility to turn things around.
I think, Ms. Kapa, let's start looking at some of the key issues that maybe you going in will be facing you currently. If you're talking about issues of budgets, security guards in various hospitals have taken to protest over non-payments, issues of infrastructure, or even the competency of those people working in those healthcare facilities. What is your strategy or focus going in that department?
Firstly, I need to understand the challenges of the department, not from a point of being a spectator now, but being part of the department. That's the first thing that I need to do. But as we spoke with the Premier this morning, one step is to speak and have an engagement with the former MEC, Nomakosazana Meth, so that there's a proper handover and a better understanding of the department. Second point, the Premier suggested that let's make this a project. There will be a team from the Office of the Premier, from the department, and well as from Treasury, so that we have a focused plan in dealing with the challenges of the department.
All right, thank you so much, Ms. Kapa. That's in Ndandogazi Ikapa, the new incoming MEC of Health there, Masa, of course, facing a number of challenges within that department. And as the Premier had also indicated, saying that the Office of the Premier is going to also assist with the work going into that department to alleviate the pressures and the issues that that department is currently facing. I mean, amongst other issues, the same department is is known for sending money back to Treasury and not for failure of spending the allocated conditional grants. I think it's time we're also going to keep an eye on that to see how things change with the 7th administration regarding that department. But not only that, but in terms of rural areas that also, affected by this department, where we find patients having to walk long kilometers to get primary health care or just even the basic services of health care. So those are the issues that are currently facing the Department of Health, Masa.